When listening for heart sounds with your stethoscope, there are certain locations on the patient's thorax or chest that you want to listen to. In other words, you're not just putting your stethoscope and listening anywhere you choose to.
So that you do things systematically, and so you don't miss anything on physical exam. To help you remember these locations, we'll use the mnemonic apartment M, or to be more specific, apartment M, number 2245. It's the location in an apartment building, but this will also help you remember areas to auscultate. This mnemonic comes from the fact that there are 4 general areas on the chest where you want to listen to for heart sounds. These are the aortic valve, the pulmonic valve, the tricuspid valve, and finally the mitral valve. The letters in the mnemonic apartment M stand for the first letter of the valves. A for aortic, P for pulmonic, T for tricuspid, and M for mitral. And the apartment number 2245 represents the location of the intercostal space of that respective listening area. So that would be the right second intercostal space for the aortic valve, the left second intercostal space for the pulmonic valve, the fourth intercostal space in the lower left sternal border for the tricuspid valve, and finally, the fifth intercostal space at the midclavicular line for the mitral valve.